Great. Well, again, welcome everyone to this quarter's BIPOC Aspiring Midwife session. My name is Kim Doe. I am midwifery faculty at UC San Francisco, and I'm also one of the co-leads for the Midwifery Mentoring and Belonging program. I am joined today by our amazing staff member, Elena Ramirez, and her son, Arthur. And we also have our two incredible midwifery students joining us, Stephanie Fletes from Cal State Fullerton and Kim Lopez from UCSF. Yay! I'm going to actually have Stephanie and Kim, we're going to start off with a question that's sort of also an introduction. And just to open up with, if you wouldn't mind sharing with folks a bit of your midwifery journey, what brought you to where you are now in midwifery? And as you start, if you could also share a bit of where you are in the midwifery education program. And Stephanie, we'll have you go first.
All right. Hi, everyone. So my journey, I don't know how far back to take this. So I think I'll start with undergrad. In undergrad, I went to UCLA right out of high school, not knowing really what I wanted to do at that point, I think, in my life. I really didn't know that you can be like an advanced care provider as a nurse. I wasn't exposed to it. I think growing up, from my background, I grew up thinking like either you be a teacher, a lawyer, or a doctor. And like anything outside of that, I just didn't know like what to do with whatever major you selected. I think I even went in as undeclared. But while in undergrad, I, through taking like chemistry and then having like a really hard time in those big 500 student auditoriums, I remember one time going to office hours and I got a really bad experience with the professor there. Like they pretty much said, if you didn't learn this in high school, then you shouldn't be in this class. And at that point I was like, okay, well then I'm not pre-med. I can't be a doctor. Let's think about something else. And then I ended up getting a job at the School of Nursing. I think I was going from like the end of my first year on to second year. And I was in the admissions office there, and I started to see like the nursing students and people that were in, I think, their MSN program, DMP, because everyone was just going through the nursing office there. And so that's when I became exposed to like what nurses could do and become and how varied their education could be. So then that's when I thought, okay, well, I want to become a nurse. Like I think this is still within the realm of helping people. I always was told like, oh, you're going to be a great teacher. Like you are really good educating people and like supporting people. But I always thought, well, I don't know. I kind of want to do something in health. And so somehow I became exposed to nursing just through my work study job. And at that point, I couldn't switch my major to nursing because I went in as an undeclared nurse. And so I thought, wow, I have to either like drop out now and try again, like reapply, or figure it out. And so during undergrad, I decided then, and through my exposure at the School of Nursing, that I would apply to the master's entry-level program, the nursing program there. And I looked at a few different options, but I thought that is my pathway. And so as an undergrad, I took up the minor of public health, and I actually majored in Chicano and Chicana studies, which also exposed me to like the health disparities that people from my background had endured. And so I thought, this is perfect. Like I'm learning about my culture, my background, and like I really want to make a difference. And there's a lot of public policy, but I felt there was still like a big gap for health, right? Like no one's addressing the health disparities. And I think at the time I became exposed to like the social determinants of health and how being unhoused or having low income, you get less care or less preventative health access. And so then I thought this is perfect to then get into nursing. And so again, I'm making it really long, but that's how I got into nursing first. And I just fell in love with labor and delivery, and I became a L&D nurse right after my nursing program. And And even before then, so during undergrad, just to take it a step back, I became a certified personal trainer, and I just always worked with women. So then I already knew, like, okay, I don't really want to work with men. I don't really want to work with children. And so I was working a lot with women just in exercise, and then was exposed to L&D during clinicals, during my nursing program. And I fell in love with it. It's like I don't know, I got a rush of being in the vaginal births, and I just thought this is where I belong. And so right after graduation, I worked as an L&D nurse for 2 years, and then I started to notice that there was a big gap in knowledge again. So like women were showing up not knowing like what's happening. Like they just were showing up in pain, and I just felt like there was education missing again. And actually, during my time in school, nursing school, I learned about family nurse partnership or nurse family partnership, NFP. And I thought, I love this. Like again, anything having to do with like education and women's health, I just really enjoyed. And so, at the time as an L&D nurse, I was still in contact with the nurses that I worked with in family nurse partnership or nurse. I always switch their name, NFP. And after working in L&D, I did get a message like, oh, I got a message about a program that was called Mama's Neighborhood in LA County. And so it was similar to Nurse Family Partnership, but different in the way that we were going to address not only first-time mothers or teenage pregnancies, we were also going to continue to work with women that were either incarcerated, battling substance use disorder, many different things. And so I got hired through Mama's Neighborhood and just doing a lot of education in prenatal and postnatal care. And then I thought, well, now that I have these tools to like teach about or focus on preventative wellness, like I want to do more. And so then that's how I then started to think, well, I can be a provider and address more as a provider, right? Not just as a bedside nurse or as a public health nurse, just educating. A lot of the time, most of the women that I was working with, either they were missing prenatal appointments or like they were just never coming back in postpartum. And so plugging them back into care was a lot of has taken a lot of the chunk of my work that I do now. I still work for Mama's Neighborhood as a public health nurse. It's shifted a bit. I'm an outpatient clinic, and I do breastfeeding class, car seat safety class, and so while being in the midwifery program. So, but that's pretty much how I got into midwifery. It's been like I've worked with women, loved it, and then I found a gap, or what I sensed was like, okay, I want to fill this gap, and then went back to get this midwife degree because I feel like I want to just be a part of all of it. Like I love the L&D aspect, but I also love being in the outpatient clinic and like, building that community with my patients and having them come back and ensuring that they come back to even their annuals, right? Not just when they're pregnant, but seeing them after. Because I'm doing the dual track program, so midwife and women's health nurse practitioner for that reason. Long story. Sorry, Kim. There we go.
No,
I'll
please
hand it
don't
over.
apologize. It's incredible. I shared some links in the chat for some of the programs that you named in case people want to read a little bit more about them. Stephanie, what a journey, and appreciative of all that you've brought in, and how so many different elements have informed where you are today. Kim, would you like to share a bit about your journey?
Sure. Stephanie, that's amazing. I loved hearing your story. I would say that my journey also kind of began in undergrad. So I always was interested in obstetrics and gynecology. At first I thought I wanted to be an obstetrician. So I was beginning to go the pre-med route right into college. I went to San Jose State, and it's funny because I was also taking these chem classes, and I was like, these are so awful. Like, I don't think I can do 4 years of this and another 4 years of like med school. Like, I don't think I'm cut out for this. So I kind of just like thought back, and I'm like, maybe I can't do it. I was doubting myself a lot. I also didn't really have the discipline at the time because I was brand new to college and still kind of figuring my way through life. So I knew I wanted to be in healthcare. I pursued a degree in dietetics, and that's where I worked for like nearly a decade or so. I worked as a clinical dietitian. And through that journey, I just felt like it wasn't the right spot for me. I wanted to do more. I wanted to be more involved with patients. I didn't want to just focus on nutrition. I wanted to just be there more and be more involved in care. So I knew I needed to do something else. I just wasn't satisfied. And I worked with PAs at the time, and I knew there were PAs, I knew there were NPs, and I was going to different info sessions and shadowing PAs at the time because that's who I had access to. And then I came across UCSF's info session one day and I attended. It was in person, and they were talking about all the different specialties you can go into at UCSF. And I remember the nurse midwifery speaker talking about midwifery, and I'm sitting there just thinking, like, midwifery, like nurses are midwives. I had never heard of that at the time. It was just so shocking to me. And it was Rebecca Kaplan, I believe, presenting, and I raised my hand and I said, "You mean like you're delivering babies?" And she laughed and she's like, "Yes, that's what midwives do." And so immediately then I was like, this is exactly what I want to do. I had no idea that advanced practice nurses can deliver babies. That's exactly like what I wanted to do years ago. And here I am finding myself in this spot. And it just felt like perfect timing. And I left that info session just so motivated, so excited, did a ton of research, because that's what I do. I do like a lot of research into anything I'm like vaguely interested in. Sounded like it was perfect for me. And I went and literally reached out to anybody who would respond to my emails. And I'm talking about like, I mean, I worked at Kaiser and there was maybe 2 midwives that worked at the Kaiser I was at. I emailed them and I was like, "Can I please shadow you? I want to interview you. I want to know more about your job. I'm really interested in a career change." And luckily I had like a few people around the Bay Area give me the time of day and speak with me, and just like really give me more insight into the career. And then from there, UCSF also had this, I think they still have it. It's called Inside UCSF. And it's an annual outreach program, and it's for underrepresented college students. And it's for them if they're interested in pursuing a health and science degree. You get to go to the school, you get to kind of look at the campus, meet with other students who are interested in pursuing a degree, and learn more about the program. So I did that, and that got me even more fired up. So from there, I was like, you know what, I need to make sure this is right for me. And I feel like that's also some advice that I got from other midwives is, you need to know that midwifery is for you because there are some people who are so fascinated with this idea of birth and, just being in all that excitement. But, you need to put yourself in that position to see if that's something you can handle. So I was able to shadow a couple midwives. That was very hard to find those opportunities, but luckily I had like a few opportunities through volunteering. I also was a doula, a volunteer doula, and that gave me a lot of experience about being around birth and being around people who are birthing. And I knew I had no problem with it. So, and every time I went to these experiences, it just solidified like this is what I need to do. Um, so I did a bunch of that and I applied to UCSF and I got into the program and here I am, almost done. I'm about 1/4 away from graduating. So we graduate in June and I'm about to start my integration, which is essentially like a midwifery residency in April. And here I am. Thanks, everyone.
Wonderful. Kim, thank you so much for sharing your journey. Also had so many different pieces that were coming together at all the right times. Um, I want to ask another question. Both of you are toward the end of your midwifery student journey, and I'd be curious to hear from each of you kind of what has it been like as a student? What can people expect in terms of um, classes, clinical, yeah, if you want to speak to that and maybe a bit of how you balance it with the other things that you have in your full lives. And this time, Kim, I'm going to start with you.
Oh, okay. Yeah, no, I would say that it's demanding, and I feel like everyone tells you it's demanding, and I feel like I'm a person who's always ready to take on a challenge, and I feel like I can handle a good amount. But yeah, it is very demanding, and I think like you're studying for your classes. I think with UCSF, our program, the first year, mainly you're just doing a lot more didactic stuff, and then clinicals are kind of sprinkled in. So you have class, you're studying for class, you have exams, you have assignments, and then you also have your clinical aspect where you're going and you're practicing those things that you're learning. So you have that, and then you also have life, right? So for me, I worked my first year in the master's year, the midwifery year. I worked that first year, and it was a part-time job that was really flexible. But come the beginning of the second year, I stopped working, and that was probably the best decision I ever made because it got more and more intense. But in terms of balance, I would say like I think I do have a good balance. I try whenever I feel like I'm like in the thick of midwifery school where everything feels very heavy. I just remind myself like, oh yeah, what did I do before midwifery school when I had more free time? I would exercise, I would read, I would, go out for dinner with my friends or so. Like I would try to sprinkle in some of that throughout my life just to kind of get that sense of normalcy back because it's very easy to get in the thick of things. And yeah, I mean it is a struggle to have that balance. And I think for me personally, I take studying and like preparing for clinicals very seriously. I think for myself, I just feel like being in this position is so fortunate. Like I just feel so lucky to be a learner. I feel lucky to be a future midwife, and I take everything so seriously. So with that being said, I do spend a lot of time prepping, studying, and preparing. Um, but yes, I do remind myself I need to have a little fun because it's very important for your mental health. But yeah, that's what I had to say. What do you got, Stephanie?
So demanding, it was like I wrote that word, demanding, that for sure. It is time consuming. I know you mentioned you guys are on the quarter system, so you're probably even feeling more rushed, right? Because I come from quarter system in undergrad, and then my nursing school. And now I'm at Cal State Fullerton where we're on semesters. And so I started the program and have continued to work full time. As a public health nurse, I'm on a 4-10 schedule. So I already have like the weekends off and I had one other day in the week. And that one other day in the week, I'm just in class all day. And it's been like that for the last 7 semesters, right? So demanding is definitely the key word, I think. And I don't have children, so it's like work and school. That's my babies. And I have 2 dogs, which take time. But you know what I mean. Like I don't have to like rush home to take care of children or cook and feed them and or breastfeed, all the things that women have to juggle. Um, so I think for me, since school is demanding, the big takeaway or the big message I want to send is like time management. You really have to be on top of your studying, prepping, because yeah, you come to clinical and you want to know like what the schedule, who are you seeing, and like what things are due, because we're training right to be able to catch things like is. I don't know, things that come to mind, like is she due for a mammogram? Is she due for uh, colon cancer screening or the DEXA scan, just different things, right, based on age and recommendations. And so prepping is really helpful, and you have to dedicate the time to, when you're not in school, you're still making time to do homework, to prep for clinical, because when you're in clinic, you're seeing patients back to back and you're not able to do all that prep work, right? And we're not saying all this to like scare anyone away from it, because it's really, I always get home and I do, like once I'm home, I sit down and then I always feel like I did something good. For some reason, and maybe it's because I love it and I love the work and just talking to women all day. But I always feel fulfilled, which I see my partner, and he works at a laborer's job, and so he comes home, he's tired and like he's just like fed up. But like I'm tired, but I'm fulfilled when I go home, right? And so I think that that's also another message I'd like to send, like whoever's, if you're passionate about it, yeah, it's hard work. You need to manage your time well. You might have to skip some family gatherings. You might have to put some things on hold. But if you love what you do, then it's worth it, right? I mean, I think that's what keeps me going. Another thing or challenge that I've encountered during school is preceptors. Those are hard to come by. Like I'm lucky that at our program, the we have a clinical placement team and they've found preceptors for us. But I know that like we've started late in the semester. We're on a 16-week period. And I know last semester, when we first started interpartum, because I think we did like primary care and then family planning, and then we started interpartum. I know that for that semester, I must have started 6 weeks into the semester, and I just thought, wow, like I'm already behind. And how am I going to cram all this and work, right? So another tip or something that I did, I saved a lot of my vacation time. Since I knew I was when I started the program, the first year was only 2 semesters, and so if I didn't, like I just ramped up all my PTO, sick time and vacation time. And that's what I've used to then continue to work full time, right? Or have a full-time paycheck because I have a mortgage to pay. But I've used those hours to then do my clinicals. And like Kim, you said you reached out to people through volunteering as a doula. You got that experience. I think building connections, networking, that's another big thing you want to do, because you want to have those go-to people that you can ask for those favors. I was fortunate that I work in the outpatient clinic here. So after 3 semesters of not being able to precept where I work, I finally was able to, because the midwives, like I've talked to them, built that relationship, and they've been able to then say, yeah, I'll take you under my wing. Like you can precept with me. So now instead of having to commute, I was commuting I live in LA County. I felt like I was going to Tijuana, like that I was like driving like 2.5 hours to go to clinical. So where I was only getting maybe credit for an 8-hour day, I was out of my house for 14 hours, and that is exhausting. So also be kind to yourself. Like on the days when you're just like, I can't do homework, I can't go to work or whatever it is, I just want to sit and watch Netflix, do it, because you need to recharge. Because if you don't have empathy for yourself, you can't have empathy for your patients. That's one other thing that I always feel like. So, because I know that, again, going back to my partner, like he'll just be lazy one day. He's a big gym guru. So if he doesn't go to the gym, he's hard on himself when he's home. I should have gone to the gym. I should have gone to the gym. But I'm like, you're not enjoying the time off that you took from the gym or from off work. So for me, like if I'm tired, like last Friday, I pulled the 18-hour shift in L&D because I'm like, this is my first shift this semester. I have to like ramp up these hours. So I stayed, and also because I wanted to deliver a patient I admitted. So I like pulled through. But Saturday, I was dead on the couch, just like a fish out of water. But I told myself, it's okay. Like you don't need to do homework today. It's okay. Like you have homework due Thursday. We'll manage it. And like I have a calendar, put things on my calendar for homework, to eating time, to gym time. I schedule everything, and I think that's really helpful.
Thank you both, Stephanie and Kim. Those are really rich responses. And I want to transition us in a couple of minutes to questions from the group. But before we do that, one last question that I generally ask during the Aspiring Midwives sessions: how or what do you wish you knew before coming to midwifery school? So we're in a room with several people who are at varying points in their midwifery journey, and kind of reflecting back on what is it that you wish you knew that you could share with others now. And Stephanie, we'll start with you.
I just bullet pointed a few of those. So I don't know how helpful this is at this point, but there's free textbooks. And again, I don't know if this is legal. I know you're on staff somewhere, but there are free textbooks, because I like going and starting, I buy all the textbooks and then maybe I'll read 2, and it's a waste of money sometimes for me personally. So having, and I don't know if I can share the link or what it's called, but there are free textbooks out there. Message me, maybe if I can't share them here, I'll give you the links, because I got it from a classmate, and those have been really helpful, because instead of having to buy all these textbooks, I can skim the PDFs, and that's really helpful. So that's one, because as a graduate student, you don't really get, or you don't get grants. There's not financial aid like there was in undergrad, and it's expensive. That's another reason I had to continue to work. And so I wish I still knew about more scholarships, but there are, right? There are scholarships, so do your due diligence of like doing the research and finding those. I think I have a link to, I was just looking at it earlier, that I can put in the chat while Kim is answering. But yeah, look for scholarships, because school's expensive, textbooks are expensive. There's a lot of group work, so I don't know if that's important for anyone, but like, that's just something I wish I knew. There's a ton of group work, at least that in my program. And what else? And just, I think we kind of touched on it on the last question, like manage your time, go into it knowing that you're going to be busy and tired, and having like tools to again, like regroup and have empathy for yourself. If you, I think one other big advice that someone told me in nursing school was have 5 people. Like, and maybe it could be 3 for you, but you always want to have someone that you can like just joke around with, call them to laugh. And I don't know about you guys, but being in healthcare, like sometimes I feel like maybe you think your jokes are not inappropriate, but like not everyone laughs, right? So you have to like have thick skin almost, I think. I don't know, but so have someone that's not gonna like hear your joke and then take it kind of the wrong way, right? Have someone that you can call just to cry with, because sometimes you just want to cry and you don't know why. And it doesn't have to be anyone in your program. It could just be anybody else. Have someone that you can just vent to and like be angry about with like policy changes, whatever it is, right? Like have your go-to people, because those also can recharge you. And I think that's been really helpful, because I don't go to the same person for everything. You don't want to burn out like your partner at home with everything, because they may not understand, and you know, you carry this home. So I think always having someone to debrief, which is why this mentorship is great. Like my mentor is Diana, and I feel like she always validates me. Like I know I say complain, and maybe it's just venting, but like I'm like, oh, I feel like I always complain when I talk to you. Like I'm complaining about having to drive this far, and now I'm complaining because I'm here 10 hours, and it's so different. Like I'm sorry if I don't sound satisfied, but she's always just, no, like it's okay to not want to do that, and she just makes me feel so good. Like I'm so I just texted her yesterday. Thanks for validating me all the time, because that's what I get from her. And so have your people, because you do need some support.
Thank you, Stephanie. Kim.
Along Stephanie's lines, yeah, I totally agree with everything Stephanie said. I think that, you know, you hear about so much about, oh, midwifery school is challenging, it's super hard, it's this and that, it's time consuming, it's demanding, this and that. All that is true. And I also think that it can challenge your personal relationships. So in that sense, you know, one piece of advice that I got that was really helpful is, you know, before you start your graduate program, you know, let your loved ones know that this is going to take a lot of your time and your energy, and that you may not be as available as you were before, but you could really use their support. You know, you'll see that it can challenge your, you know, your relationship with your partner, your relationship with your friends. They might be like, you never come out anymore, this and that, you're no fun, you've changed this. And what I have found is that your real ride or die friends, they really understand how hard you're working, what you're going through. You know, I just remember last weekend, I was telling my brother, I'm so sorry I haven't visited my nephew in so long. It doesn't mean I don't love him. I miss him so much. I've just been so busy. And he's like, you don't need to explain anything. He's like, I already know, you know, and I'm so thankful for that. So I wish I knew also that how much it would challenge my personal relationships. I was a little prepared for that, but you know, I'm thankful that I have the support I have now. And then contrary to Stephanie, I actually felt that there were a lot of opportunities for scholarships and funding in like at least at UCSF. I've been really lucky that my first year I found a job as a graduate student researcher And that was also through UCSF. And the specific position I found also paid for my tuition that first year. So I was very, very, very fortunate. But I had no idea that things like that existed. And actually, one of the big things that kept me from making a career change was thinking about how much it was going to cost me. And, I was already a dietitian for nearly a decade. I had my career established. What am I doing? Pulling out a loan and going back to school and starting all over again. That was a really, really big thing for me. And now that I'm in it, I'm just like, I have zero regrets. Like, I might have like a small loan I need to pay off, small. But I think it was completely worth it. And I've been really lucky to get some scholarships. They're definitely out there. I think UCSF does a great job with letting you know what's out there, and finding jobs through this school or through UCSF in general. You can either get an offset on tuition, or if you have a job like the job I had, it covered my tuition entirely. So that was super, super helpful and took a big weight off my shoulders.
I'm in the camp of we need to find a way to pay midwifery students to be midwifery learners. That is the midwifery workforce we need to invest in. Kim and Stephanie, thank you so much for sharing your personal stories and perspectives. I can't say enough how much I enjoyed it, and I'm sure others on the call also. Elena,